So today's video is actually quite controversial. Today I'm going to be arguing why dentistry is better than medicine. Hey guys, it's Charlotte and I'm a second year dental student studying at Barts London, and in this video I'm going to be telling you why I chose dentistry as opposed to medicine. I just want to start off with a disclaimer. I'm not saying that medicine is all bad. I'm not saying that you shouldn't pursue medicine if you want to. I'm just explaining my viewpoint and why I decided on dentistry as opposed to medicine. So first of all, let's start off with the application process. The application process for medicine and dentistry is actually quite similar. With both, you need to get some work experience, you need to write a good personal statement, you need to do the UCAT and or BMAT, and you need to go through the interview process to ultimately get your offer. With work experience, for dentists, you need about 2 weeks of work experience, which is basically shadowing in a dental practice or a specialized dental clinic if you can. And for medicine, you need to get a caring/service role, and this is basically you volunteering in a hospital or something like that, and you also should get some shadowing. The interviews are actually quite similar. They can be MMI or panel, and are often one of the most important deciding factors as to whether you'll get the offer. So the application process is quite similar and almost the same in difficulty. However, there are less spaces in dental school, so this makes it more competitive and harder to get an offer. And in terms of the university course itself, both of the courses, believe it or not, most people actually don't believe me when I say it, both of the courses are 5-year courses. At the end of both courses, you'll get a doctor title. They're probably about the same difficulty. Most people tend to think that dental school is much easier because it's just about the teeth, but it actually isn't. You do need to know about the whole body, systemic diseases, and how those affect the oral environment. There's a lot of things you actually do need to know. And then we do obviously focus into the head and neck physiology, because that's what we're going to be focusing about in clinics and in actual practice. There is a lot of overlap, especially in the preclinical years, so you'll basically be learning almost the same thing as the medical students if you do dentistry. So don't be fooled into thinking one is easier than the other. So in terms of clinics in university, dental students obviously start from the get-go. Like from year 1, you'll go into clinics, we work on phantom heads and do procedures on them, and then eventually we can get our own patients and do procedures on them for free. And all of these are to develop our clinical skills before we graduate. It's a very hands-on career, so it's very important that we get into it from the start. For medics, their clinics is mostly actually observation. They shadow doctors and follow them on ward rounds and just understand how the hospital environment works. It's not really as hands-on as dentistry until you graduate. So in terms of training, once you graduate, both of them, you actually do need to do some training outside of school. So for medicine, there are 2 years of work experience called F1 and F2, which you kind of have to do to qualify as a doctor and to specialize eventually. Then there is specialist training, which could be around 5 years or more, depending on what sector you want to go into. So for dentistry, there's only 1 year of foundation training, and then after this you can decide whether you want to do additional training to specialize. And then after this, there's a minimum of 250 hours of CPD, which is basically continuing professional development every 5 years, which allows you to keep on top of your clinical skills as well as continue to learn about new techniques. So how long you want to train for after your degree is actually important in deciding whether you want to do medicine or dentistry. Salary. Now, we all think that dentists earn a lot, that when you go out you'll be driving Bentley, but this is a lie. Although both of them are stable jobs which do provide a good salary, these are not necessarily the highest salaries ever. A lot of people think that doctors and dentists are very rich, but honestly there's other career paths where you can earn more money with less training, so don't go into either of them for the money. So the starting salary for a junior doctor is about £28,000, and foundation doctors can earn up to £32,000 2 years post-graduation. Specialist trainees can earn around £37,000 to £48,000 a year. Once you become a consultant, which can take up to 8 years after you graduate, you can earn between £78,000 to £105,000 a year. On the other hand, straight out of university, the annual salary for a dentist in foundation training tends to be around £32,000. Afterwards, NHS dentists can earn between £38,000 to £110,000 a year. This obviously depends on your location and what you're doing. There's also a wider scope for private sector work as opposed to medicine, and private dentists can earn up to £130,000 a year. So let's move on to day-to-day activities. So medicine is more varied in what you can do and what you can specialize in. You can become a GP, a surgeon, or you can even work in hematology. There's a lot more specialities than there is in dentistry. Dentistry is more specific and can be seen as repetitive, but honestly, there's a lot of different cases that you'll see, and also there's also a lot of opportunities to specialize. Within dentistry, You could do endodontics, you could do general dentistry. There's so many choices as well. Work-life balance. So you probably already know that both of these jobs are very demanding, but dentistry tends to be the better lifestyle choice. In terms of medicine, especially foundation year, where you're jumping from placement to placement, you're doing some A&E, you're doing some ENT, you're doing some GP, you might not have a lot of time for yourself. You're going to be jam-packed, and you might even have to revise for exams during these years as well, which means that you'll often be working at unsociable hours. Your best bet at a healthy work-life balance is to specialize into GP, or you can do something like dermatology or psychiatry, but obviously these are hard to get into. For dentistry, it's typically a 9-to-5 job with weekends off, unless you're on call, which makes it a really good lifestyle choice. Ultimately, whether you want to pursue medicine or dentistry, both of them are amazing career paths, do not get me wrong, but it will depend on your personality and what you would like to do. I hope you enjoyed the video, and if you did, be sure to leave a like, comment and subscribe. I'll see you guys next time. Bye.